Thanks for tuning in to Veterans Voices. I'm your host, Joshua Zebley, and my co-host is Elena Kim. Today we'll be talking about a difficult subject, mental health and suicide prevention. If you want to be part of the conversation or you have any questions, just use the QR code on your screen to join us in Zoom webinar. We are aware that these conversations can be triggering, so we'll be showing the number for the Veterans Crisis Line during the show. If you start to have difficult feelings, please call. We want to start our show with two veterans who understand struggles and mental health and thoughts of suicide. I want to welcome Air Force veteran Evan Jones and Army veteran Jacob Narotsky.
Hey, Josh.
Welcome to the show, gentlemen. Thank you for joining us. Jacob, we're going to start with you. Can you tell us a little bit about your military career and your struggle since?
Yeah, I think I have a story that's mirrored by a lot of folks. I spent most of my adult life serving the United States Army. Most of that hanging out the side of a UH-60 Blackhawk helicopter. And when life is going, 150 miles an hour every day, all the time, you get used to it. You learn to compartmentalize. You learn to keep your head in the game. And a large majority of the time I spent in the military was spent downrange. We call it downrange, or deployed in Iraq and other places. And I think that there's a lot of things that you see, and there's a lot of moments that you're part of and experiences that you hope end when the experience ends, but they don't. They come home with you. And for me, 2007, 2008 in Iraq, during the surge, specifically Operation Iron Harvest and some of the other missions that we did, there's a lot of pieces, a lot of moving pieces, a lot of things that you're part of. I can remember January 16th, 2008. That will always stick out in my mind. And middle of the night, it's like 4:30 in the morning. Our aircraft's got, we would later find out, 37 rounds through the aircraft, including the tail rotor, one of the engines, radios, doors, shoot through our helmets. We're out of ammo. We're in a bad spot. And we've got a squad of guys below us on the ground, and most of them are wounded or already gone. And moments like that they imprint on your mind. And I look a few years later, coming home and getting out of the military, trying to find some semblance of normalcy, moving to Auburn, Alabama, War Eagle, got to put it out there, y'all. Had an opportunity to learn how to fly airplanes in flight school here at Auburn, and had opportunity to teach high school and be a high school football coach and so many other things. And all the time I'm carrying these experiences, these memories of these things that happened. And so like I said, for so many guys, the story winds up being the same. Just know that you're not alone. And it's a lot more common than we like to let on.
Jacob, I'm so glad that you're here with us today. Thank you so much for sharing that story. Evan, I'm going to turn to you. Can you give us a little introduction to yourself? Tell us about your military career, and also if you wouldn't mind sharing your struggles since.
Yes, thank you. So I grew up in Colorado, and I always wanted to be a knight when I was a kid. And then, from there kind of morphed into, Indiana Jones, James Bond, that kind of stuff, just all that kind of stuff caught my eye. Eventually I saw a commercial for the Marines, one of those Marine commercials got me, and I loved it. And that's what I wanted to do. My parents had a different plan, which was, at the time I just didn't have the presence of self to really do what I wanted to do. So I ended up, they got me a mentor within the Air Force, an old F4 pilot. He helped me get an ROTC scholarship to Montana State University in Bozeman, Montana. And so I started going the Air Force route. I found out, that just didn't resonate with me. I was sort of pot committed a little bit in the Air Force realm. And then I decided to drop out of school, enlist, and find the most Marine-like Air Force job that I could find, which was combat control. So I was a combat controller in the Air Force for 15 and a half years. It's a small career field within Air Force Special Operations. it's kind of like air traffic control, but air traffic control within a combat situation. And we go through similar training, like the SEALs and Rangers and Green Berets, like Halo and Hey-Ho and combat dive, and lots of shooting and driving and PSD and all that kind of stuff. So I did that from 2004 until, May 2004 until December. I'll get them right. December of 19. And there was about a 10-year time frame within there that I deployed a number of times, a little bit over 3 years total overseas, lots of different contingency operations and just special operations and stuff, and was in the thick of it. Just in the thick of war. During my first combat deployment was the first time I met suicidal ideation. I was involved in a civilian casualty incident where an infant died and some of the family died. So men, women, like literally men, women, and children. And that was just immediately heavy for me. I immediately wanted to kill myself. And I dealt with that feeling from 2008 until 2021 when I started working with plant medicines and stuff like that, stuff like ayahuasca and psilocybin and ibogaine and things like that. And so I healed from the complex PTSD that I experienced, and now I'm in a space where I'm coaching and speaking about these kinds of things, letting people know that there's hope out there. There's things that we can do. I've been in that hole where it feels like you're getting buried alive. I've been there. I was there for a long time, and I'm out. I feel fantastic, and I want to share it with everybody I possibly can. So that's where I am.
Thank you both so much for joining us today. I mean, hearing your story, I get chills literally because you both overcame, some very, even some dark places, right? And just by you going out and helping other veterans, that's what we're all here to do. You two have the unique experience and it's not a good experience, but you have the experiences of now you can help other people. And it means so much to us veterans that you're doing that. I mean, you're stepping up and saying, I want to make sure somebody else doesn't feel like this or how can I help them? And only you know those. So thank you so much for joining us today and helping us with this show. Jacob, you've been out for 15 years? Is that about right?
It's a whole nother lifetime. Yes, sir.
and today, I mean, I've read your bio and read things about you. Is this something you wake up every day and kind of like, I need to really put myself in this, I need to think about this daily, otherwise I could end up back down there. And I want you to answer because I want and both of you will, for veterans that they feel like I've made a lot of progress in my life, but I still need to remind myself, sometimes I'm going to feel bad and it's okay, but this is how I get out of it. I think that would be some great advice for a lot of veterans.
Yeah, my journey really starts in a cemetery in Pennsylvania. When I was 14 years old, my father, who was a minister, committed suicide. And that journey continues until 2021, standing in another cemetery in St. Louis, watching another good friend, one of the pilots that I flew with, watching his family stand in that same moment I had stood in all those years ago. And there was a realization in that day. I mean, like, that was my low point, where I was like, look, if I don't do something, I'm next. And I reached out and got the help that I needed. I reached out to Wounded Warrior Project. I met Rich Watson, and I reached out to the VA and met a counselor. And I had to realize that my life meant more than my past. And I had to begin looking forward. It's funny, I've heard people talk about it being digging your way out of a hole. And for me, it wasn't so much as digging my way out of a hole, is just looking up. And instead of looking down, I was digging through. My hole became a tunnel. And when you dig through, you will come out. And after that, you just need to surround yourself by people that will be there for you next time you try to start digging, because the memories come back, the moments come back. They're never going to be gone forever. But when you surround yourself by people that love you and understand you, the next time you start to go somewhere, you don't reach out for help. They're grabbing you as soon as you go radio silent. And you're creating this network or this safety net that keeps you from falling back into that hole again. And for me, that is every day, every single day. I talk to Lynn and Hal and Roland and Cole and the guys I spend so much time with. And those are the guys that know. They know if they haven't heard from me in a day or two, they're reaching out to me. And that's what's so important.
I mean, that's amazing. You set up a proactive approach to your own, health and safety by telling your friends and letting them just know. Maybe they didn't have to tell them, but if you don't hear from me a day or two without me telling you, hey, I'm going camping or something like that, then please reach out. Maybe you didn't say those exact words, but that's what it sounded like to me.
Yeah, I think a lot of that is understanding, not just me understanding that about my friends, but having friends that understand that about me. And so, I got guys that I check in on. I have a friend from North Dakota, a good buddy of mine that I flew with. He was left seat, right seat with me in the helicopter for years. And we talked last night. He called me about 9 o'clock last night. He's got some challenges he's facing, and we just talked. And it's that idea that we're looking out to get that help, and there's others looking at us, making sure they're there, whether we ask for it or not. And it's this idea of like doing life together, not allowing each other to be doing life alone.
Exactly.
Evan, I know you shared so much with us about your personal journey, and I really appreciate you sharing some of that, because these conversations are not always pretty. I had a question for you, as you were going through your own mental health struggles, and you talked about, meeting suicide ideation, and then coming all the way out of it to the point where you're standing here today and you're professing your own happiness is such a beautiful thing. That must have been a long journey with ups and downs. I'm curious, what did you learn about yourself during that time?
That's a great question. Everything. Just everything. Yeah, it's interesting. The whole analogy comes to mind, and I like how Jake said, just that looking up, like we're kind of in the hole. For me, I can speak from my experience, but I was in that hole, and I was digging, I was thrashing around, it was just painful. And then there was a point at which it was a combination of things. I had some people come in, maybe looking around, and like maybe kind of caught me in that hole and like, hey, like, you want to get out of that hole? And yeah, I was like, yes, I want to get out of that hole. And then, but it took a lot of different things, me being honest with myself, and that it took like that external accountability and all that kind of stuff, and then also just me being honest with myself, seeing the situation that I was in, feeling the situation that I was in. But when you ask about like what did I learn about myself, it's just everything. There's so much. For example, I guess like the plant medicine stuff comes to mind. So I worked with ayahuasca, which is, it helps you look internal, and you get to just see, it's kind of beyond words, but you get to see a lot of internal things. It can be generational things. It can be, it's just a whole new perspective. And recently I worked with the San Pedro cactus, which is another plant medicine that it's an associative medicine. So it brought me into myself, and I was describing it this way, that before San Pedro, for example, I was like on this mountain, and I knew the landscape of my life existed. I knew it was there, but it was cloudy. It was like overcast. So I'm on this mountaintop, and I know there's landscape around, but I couldn't see anything. And then San Pedro came along and just instantly like everything was clear. Like, so it went from like overcast to just a perfectly clear day, and I could see the entire landscape of my life externally, and I could also close my eyes and see my my life externally, and then my heart internally, in a way that I could never, like I never had the capacity to observe it. And looking internally, I saw my heart in a way, just with more clarity, more clarity and honesty that I can imagine. And my heart is big. Like I just honestly have a big heart. And I was talking with somebody about it earlier today. When just even in childhood, when I first, like some of my first conscious memories were having that heart, but then also it being met with, like my older brothers, they're just mean. Like I love them. I love my brothers to death. But at the time, like I was born into just this hostile environment. And I was in that hostile environment all the way through my military career. And I had this big heart. I joined because I wanted to, I remember this. This was like a thing I said to myself. I joined because I wanted to go to hell so other people didn't have to go.
Yeah.
And that was just real. Like that was a real thing. And then, you know, I experienced that, but this whole time I had this big heart. So, you know, when I think about everything, but one of them is like my heart. I learned, you know, most recently about just like being honest with myself about this heart that just loves to give. Like I love people. I love connections. I love ideas. Like I love stuff. And it's stuff like that. But I mean,
Thank you, Jacob.
Your ear off. I don't want to take all
No,
the time.
you're good, Jacob. Sorry, Evan. Thank you, both of you, for being here. I mean, I can tell that you both want to help other veterans, and you have the passion for it. I think your stories are amazing. Veterans that are watching, what would you tell them? We have about a minute left. Some veteran calls you and says, "Hey, I am not feeling well." What is the first thing you would say in a couple of sentences? What would you say, Jacob?
This happens almost every day.
I believe
Somebody
it.
calls me, and the first thing I say is, "Hey guys, let's grab coffee. Sis, let's grab coffee. Let's talk." Dude, I get it. You got stuff going on in your life. And to all y'all that are watching this, if you're carrying a burden, I get it. You got a burden. Let's connect. Let's do life together, and let's unpack this thing together.
Thank you, Jacob. Evan?
Yeah, what comes to mind is just, you know, with my brother or sister, whoever it is I got you. We have this. I got you.
I got you as 3 words, but I think those are just as important as I love you, right? I mean, that's huge. We're taking a brief break, but when we come back, we'll be talking with organizations that are finding new ways to engage with veterans at risk. Stay with us.
We all make more than 35,000 decisions a day. Most are small, but some can be life-changing.
When it comes to taking care of yourself, the most important choices can be hard to make. Like having a tough conversation instead of ignoring a buddy's call.
Or being there for support, not assuming things will just get better.
Or fighting through challenges rather than giving up.
And while we all face thousands of choices every day, there's one that can make all the difference. Today, make the decision to be there for the veterans in your life, for your community, for yourself. Learn more at BeThereForVeterans.com.
Back to Veterans Voices. We're talking about mental health and suicide prevention for veterans. If you want to be part of the conversation or you have any questions, just use the QR code on the screen to join us in Zoom webinar. In our second segment, we want to highlight some innovative programs that are helping veterans with their mental health. Jim Zenner of the Veteran Peer Access Network and Sam Dorison, co-founder and CEO of Reflex AI. Welcome to the show. Jim, can you tell me a little bit about the Veteran Peer Access Network?
Quickly, I work with LA County Department of Military and Veteran Affairs, and prior to this role, I was over at the Department of Mental Health where we launched the Veteran Peer Access Network. really to address the thousands of veterans who are not eligible for the VA falling through the cracks, but also to help get veterans into the VA if they were, as we run into them out in our county. And then also family members. We heard from family members in the county that, there really isn't anything for them. And, sometimes they thought, well, because my spouse or my partner is a veteran, I need to go to the VA to get what I need as their family member. And, we know the VA has a lot of great educational benefits, not just for veterans, but also for their family members. And so it's just a huge navigation maze. And what we found as a county is that a lot of our men and women who served our country and their family members were just not getting connected to what they need to. And we see homelessness as an access issue, and we certainly see suicide prevention as an access issue. And so, really proud of our board's leadership to create and fund the Veteran Career Access Network to close the gap on that issue.
Jim, thank you so much for taking time out of your busy day to be here with us. And you too, Sam, I'm really excited to hear about how you are basically using software to train veterans to help their fellow veterans. So can you tell us a little bit about Home Team for Veterans, Sam?
Absolutely. Thanks, Lena. So when we started looking at veteran mental health and really focused on the peer support access, it was based on data that we had gotten from veterans that over 92% of veterans want to be part of the solution and support each other with mental health challenges, but only 25% of veterans feel prepared to do so. And there's over 18 million incredible veterans across this country. And what that means is there's millions of veterans on the sidelines who want to help, but don't feel confident in being able to have those conversations with their peers. And for us at Reflex, our expertise more broadly is we build super realistic training simulations that are used in a wide range of settings in mental health organizations, in addiction organizations across the country. And this is a simulation opportunity, that the ability to practice those hard conversations with a peer in a safe simulated environment, and then to go have that conversation with someone that you care about in your life that you might be worried about, to us was really in the center of the bullseye for what we can do. So we developed Home Team. It is completely free. It's available 24/7 to every single veteran. And we could talk a bit more about what's within Home Team, but at its core, it's 4 very short modules to build the skills to have those types of conversations, along with 3 simulations that allow you to practice those skills before you go out into the world.
Thank you, Sam, and thank you, Jim, for joining us today. So, Jim, you mentioned you work for the County of Los Angeles, basically the CVS of Los Angeles, right? So you not only have this experience here in LCSW as well, so I think you bring a unique opportunity to speak to someone that has such a huge veteran population. All the things that you've done, I felt like you'd be a perfect guest for the show. VPAN is something I've heard of for 6 or 7 years now around that. How can other counties or other states model this? What's the backbone?
Yeah. So we do, it's searchable online, but we did, as part of the launching of VPN, we created an action plan that is scalable to, obviously we're one of the bigger counties, and that's a lot of kind of what I hear from our medium-sized or smaller counties. Well, that what works for you doesn't work for us, but it's scalable. And us VSOs, we're generally super busy, as you know, Jacob, and we don't have time to do the outreach and navigation that VPAN is doing here in LA County, on the same team and alongside our VSOs. And so, you won't need 50 peers like LA County if you're a medium or small county, but 5, 10. Also part of VPAN is we engage the philanthropic community. Our fiscal intermediary is a convener of what they call the Veteran Funders Group. So 15 foundations that want to fund and do fund veteran causes. And so we know as government, we can't fund things quickly, but we know philanthropy is a lot quicker. And so we're very intentional about that partnership, and that also is part of the scalable model behind VPAN that other communities, regardless of size, can can emulate. So there's a lot to emulate, and I will make sure that I send that action plan to you so that you have it, Jacob, if you don't. But yeah, and we just welcome. I've had conversations with about 4 other counties in California that want to create it. We know that peer-to-peer is the way to go. VA does have peer supports, but they're generally linked to treatment teams or part of programs. They're not out in the community like VPAN, engaging, tapping into county infrastructure, city infrastructure to get veterans that just have not been traditionally engaged. So yeah, very scalable, and I'm happy to talk to anybody and share any information that we have as far as blueprints on creating the Veteran Peer Access Network.
Thank you, Jim.
Thank you, Jim. And Sam, maybe you can start us off with this next question. And Jim, I'd love to hear from you after Sam. Both of you guys are pretty high up, so I know that you guys aren't, on the ground every day with this work, but I would really love to hear a success story that you have, Sam, regarding Home Team, and Jim regarding the Veterans Peer Access Network in Los Angeles.
Absolutely, Elena. So I think even though I've been fortunate to be one of the co-founders at Reflex in this work, I feel really privileged to get to hear those stories every day, every week from veterans. And the core to Home Team is the belief that building connection and supporting someone in a mental health challenge is a skill. That in the same way that no one wakes up in the morning and says, wow, I now know how to do CPR, you have to learn how to be really supportive. And there are things that you might think are helpful, but actually aren't. So I'll give you two real world examples on this. One is if someone says, hey man, it's just been a really shitty 3 weeks. The instinct on a type of reaction is, I've been there, don't worry, you'll get through it. Or, you'll get through this. But actually what you've done there is you've shut the door, right? What you're looking for is something like, I'm really glad you mentioned it, what's going on, right? Opening that door in that really challenging moment. And the same is true when talking about suicide. If you're worried about someone and you think they might be thinking about suicide, you should ask directly. You should say, hey, I'm really worried about you. Are you thinking about suicide? Because when you do what might be instinct to a lot of people, including me, is, do I want to put this idea in their head? Should I skirt around this? What you end up doing is stigmatizing it, right? Or not being direct. And by actually asking directly, you put yourself in a position to help them find other resources in their community, including the VA. So these are things that you have to learn. And when we talk to veterans who have gone through a Home Team, what we hear disproportionately is, now I have a list, right? I have an action plan. I have things that I can do when I'm worried. I now know what to look for when I'm talking to others in my life. I can be part of the solution, not a bystander. And for the vast majority of veterans, and certainly the vast majority that are participating in Home Team across the country, they want to be part of the solution.
That's an incredible segue into exactly what I was saying. Sorry to cut you off, Elena.
No, go ahead, Jim.
But what I was going to say, Sam, is really, veterans don't want to be served. Veterans want to be of service. That's what draws us to the military. We had fires in Los Angeles recently, and veterans were trying to find ways to get behind the fire line to help evacuate people. I mean, that's who we are. We're not broken veterans. We're not broken, which worries me as a CVSO, like the image that the community has of us veterans. And so the heart of VPAN and a success story is one gentleman who spent 5 years in jail after Navy for addiction-related offenses. And really, he got out and he just was like, I'm going to change my life. I'm going to make my family proud. We brought him on at one of our community-based organizations as a VPAN peer. He quickly shined. He went to MSW school. I took him on as an MSW intern. He helped me write county legislation as an intern, put him in situations to where he could just continue to shine, because this guy definitely is on the move. And recently hired him as a supervisor to oversee a couple of the VPAN teams and our justice involved work here in the county of Los Angeles. But that example is the spirit of VPAN. Like, it's not just this service that's going to help veterans. It's like a movement to where we're looking for veterans that are maybe kind of lost or need their tribe, and we bring them in and like, okay, do what you did in the military. Take care of your troops. Some of the stuff that I really liked about the military, taking care of my soldiers, that's basically what VPN is. So you got that familiarity. So veterans that feel lost, that feel like maybe they're not connecting with their community and their community is not connecting with them, come work at VPN, take care of each other, and you're going to find your way along the way. And I piloted a program called Battle Buddy Bridge, which led to VPN in 2014. And I remember this female Marine, she was like, had no idea what she wanted to do. But when she started at VPN, she's like, oh, I want to go to school and I want to get into healthcare administration. I mean, helping vets directly is good, but I have this long-term vision of running a VA hospital. Now, 10 years later, she got her degree in hospital administration, and she's working in the senior executive leadership office at our VA medical center. But that's the spirit of VPN, exactly what you were saying, Sam. So we want to be part of the solution. We were part of the solution in the war of terror or before. We can be this part of the solution again.
I really like what you said, Jim. Veterans don't want to be served; they want to serve. And getting back together with our group of veterans, or even if our coworkers are veterans, that's how we're helping each other. And Sam, teaching the skill is the easy part, right? The veteran or anybody has to have the will to want to learn the skill. So veterans that are coming to you, or anyone that's coming to you, family members, they're already halfway there, and you're just providing them with the tools to complete that skill or to help another veteran. So I looked at your website this morning, and very easy to read. I mean, FAQs are great. First thing people are going to look at, is it free? I saw that it was free. How long does it take?
Totally free.
Not very long. 4 modules, right? So this is something we could do, from home, from anywhere we want. That teaches us how to help veterans. I mean, we're not going to become an accredited LCSW, and that's totally fine. That's not the goal. Our goal is how to have these initial conversations with veterans. So thank you very much. We have a couple comments from our Facebook audience. Talking about being proactive, which we all mentioned. It's key in the recovery process. Having a plan and having a battle buddy. So these are from our audience. All we've talked about, I think the theme of the last 30, 40 minutes has been, you need to have someone who can help you. And you folks are here to help.
Jim and Sam, again, thanks for being here. I'm just listening to you guys and thinking home team, it kind of sounds like it would almost be like a feeder into the Veterans Peer Access Network. Like after this, you guys should link up, because it's like, Sam, you guys are training folks on how to be the best battle buddy to veterans. And then, Jim, you're putting those veterans who want to help to work in a sophisticated network serving veterans in Los Angeles County. If we could just pair you guys up and then replicate throughout every county in California and across the nation, we would be pretty unstoppable. It'd be pretty amazing.
Well, and I was going to say that's exactly right. And for us, when we started Home Team, we said, we should be in the background. It's not about us, it's about the veterans and the veteran service organizations, and it must be free. So we actually, when we started building Home Team, that was the anchor of how do we make sure it's free. And we audaciously went to Google and said, will you pay for this so it can be completely free? And they said yes, and then helped us speed up delivery. And now we get to make this available to every veteran, but also available to organizations like Jim's and others that are on the front lines, right? We are truly not on the front lines of this. We are in the support infrastructure, but making sure that the organizations that are have everything they need to do this work.
Amazing.
Yeah, absolutely. I mean, a lot of training needs, because it's really entry level, right? We're, veterans that are going to school maybe don't find out that school isn't for them, and they're kind of just lost. So we're getting, veterans, with no experience at all in the helping profession, other than their experience in the military as a leader, taking care of others, which often that experience for us gets overlooked by civilian employers. But, really needing a lot of training and support. So, yeah, I actually was writing down Sam's information, Reflex AI and Home Team on my little notepad as he was talking. So, yeah, and consider us linked. So thank you, Elena and Jacob, for linking us.
Jim and Sam, as we discussed how important it is to be proactive, has there been thoughts, and this is a little harder maybe for you, Jim, but let's talk to them before they're veterans, while they're still active duty or while they're still in. How do we do that, prepare them when you get out? Things are going to be different. I'm talking about the transition assistance programs, but specifically what you all do. This exists, Sam, this exists. Are those conversations you're able to have?
Yeah, we have those conversations, and this is part of that, right? Is there might be active duty folks watching this today. So really being clear that the best time to prepare yourself to serve others is now. And the second best time is as soon as you can from now. And as we were developing Home Team and having these conversations and talking about this publicly across the country, it really is about saying, this is quick, right? You can learn this really quickly, and you are overwhelmingly likely to use this in your life, right? The statistics on veteran suicide are significant across the country, and several thousand veterans die by suicide every year, which means you are likely to know someone who's having these thoughts, and you can take action. So it is absolutely something that the more proactive we can be and the more proactive our partners can be and the country can be, the better it will be for every single active service member and every single veteran.
Thank you so
Yeah, I
much.
sit on a couple of national associations, and really I talk a lot about, the power of local government for transitioning service members. And really, we just need better coordination from our federal partners to know who's getting out of the military and coming back to our counties. Because, I don't know about everybody else, but I didn't transition from the military to a VA hospital. I transitioned to my local community, my county, my city. And we just need better coordination from our federal partners to know who's coming in. And that way I can reach out to our local workforce boards and really start, surrounding them with employers, surrounding them with what they need when they get out, surrounding them with a sense of community, surrounding them with a network. When we serve in the military, it's 4, 8, 12, 25 years of catch up that we have to do regarding building a network where, everybody we went to high school with, they have careers and are far down the road as far as developing a professional and personal network. So, we just need better coordination from our federal partners, and we can really, as local government, knock it out of the park, supporting our men and women who serve our country. We're not sitting there waiting for our federal partners. We are doing a couple of things proactively. There is Onward Ops, which they do outreach to military service members to get them to opt in. And if they opt in, they're paired with a sponsor where they're going to move when they get out. So we do participate in that. Unfortunately, we're not getting as many service members as we'd like to serve through that program, but it's building. Also, really looking forward to building a skill bridge program in our county and really partnering with Department of Labor through their employment navigation program to just really kind of show what's possible and waiting for them in LA County, should they decide LA County is their home once they transition out of the military. So we're being as proactive as we can, but really the heart of this is we need better coordination from our federal partners to really kind of tackle this piece.
Thank you very much, Jim and Sam. When we come back, we'll give practical advice if you or someone you love is struggling with their mental health. Stay with us.
Honestly, I'm not really sure why I'm calling. It's just...
I'm having nightmares.
My husband and I, we're just fighting a lot.
I can't get any sleep.
Things just keep getting worse, and it's starting to feel like I can't do this by myself anymore.
We could use some help figuring things out.
Okay. Well, I'm glad you called. Why don't you tell me more about what's going on? There's no wrong reason to reach out for crisis support. Whatever you're going through, the Veterans Crisis Line is here to help. Visit veteranscrisisline.net to learn more.
Welcome back to Veteran Voices. We're talking about mental health and suicide prevention for veterans. If you want to be part of the conversation or you have any questions, Just use the QR code on your screen to join us in Zoom webinar. As we conclude our discussion, I want to focus on things we can all do to help. Jim Zenner and Jacob Naratsky rejoin us as we are adding Deborah L. Taylor, Suicide Prevention and Community Engagement and Partnership Coordinator for the VA in Northern California. Thank you all for rejoining us and joining us, Deborah. So this is the time where we're bringing the community partners. You all are the ones who are really getting out there, helping veterans every single day. So we want to have some conversations about that. I do have some questions in Facebook we're going to get to very soon. This is the most we've used Facebook, so I'm very happy that we have our audience participation today. We will get to you. Thank you. Deborah, can you just tell us a little about what you do, and what do you think the first steps for a veteran who's having difficult thoughts of suicide are?
So I'm a licensed clinical social worker with the VA, and I've been with the VA for about 10 years. I love working with veterans. And in my role, I work with the community, educating the community how to also work with veterans. The one thing I've learned about veterans is being direct is the best. And I think Sam mentioned not being afraid to ask that question, are you having thoughts of wanting to kill yourself? You're never going to put that into somebody's mind. So don't be fearful of that. And that is just the best way to start off. If you're having any thoughts that that person is struggling with suicidal thoughts or they're isolating, you just want to be upfront and ask them that question. And then from there, you can, do some other moves that will help that veteran. But just asking them, I think, is the first thing that is important, and not being afraid to ask that question.
Thank you, Deborah. Thanks for joining us. Sorry, Elena.
No, go ahead.
That's all I was saying.
Oh. Well, Jim, you're working with the Veterans Peer Access Network, and you talked about how this includes both veterans and community members, but also you specifically mentioned family members, right? And friends, right? So I'm curious, what are the first steps that you believe are for families and friends when they're noticing that a veteran is struggling with mental health issues? What would you sort of give them advice on?
Yeah, not to give up, because it can be very frustrating. I can speak for myself. When I got out of the military, I was thinking that everything around me was wrong and I was right, and caused my family a lot of heartache while I was figuring my way back post-service. So, one, be patient. They do love you. It's just they can't figure out what's going on in their head. And continuing to encourage them. You never know when you're going to encourage them at the right moment, at the right time, to get them to really think. And really, if things get to the point, giving your family member an ultimatum. I remember, growing up in a household, my dad was a Vietnam vet, and it got so bad that my mom had to give my dad an ultimatum: you're going to go to the VA and get help, or, I'm going to take the kids and I'm going to leave. And that was what it took to get my dad to get help. And we got my dad back, and he had a lot of coping skills he didn't before, and it saved our family. So, that's the first couple of things that come to mind. And really kind of reach out to folks at the VA. I know the suicide prevention teams at the medical centers, they work with families all the time, and they're a great resource to talk to really kind of strategize how to get their loved one into care. So that's just some thoughts that come top of mind.
Yeah, thanks, Jim. And, giving that veteran perspective, well, you've actually had both perspectives, right? As a veteran and as a family member of a veteran, because you shared about your dad too. Deborah, I'm just wondering, you work for the VA. Some folks, well, we already know that, folks who are struggling with suicidal ideations, they're often not in touch with the VA. What does it look like for them to come to the VA? Should they be afraid of that process?
So no, and my role is not to get those veterans that are in the community to come back to the VA necessarily, but I am always educating them on all the changes. I mean, we know the VA makes a lot of changes all the time. And so there's always new programs, there's always new pathways that the vets can take advantage of. I work a lot with the homeless veterans up here in Butte County, and I always let them know there's other programs that maybe you're not aware of. The other thing that's important in our rural areas is the vet center. So for those veterans that don't feel comfortable at the VA, I always remind them, you could go to the vet center. The vet center doesn't, we don't connect with the VA. So they feel a little bit, I guess, safer there, that their information's not going to be shared. But the vet center, any veteran that has passed away by suicide, the vet center offers therapy for their whole family members, which is something I did not know. And I just find that's really powerful that they offer that. And especially for those vets that don't want to seek treatment at the VA, the vet center is a great place to start. And so we do refer a lot of vets out there to get some of that therapy. And we actually just had a family that reached out to me asking for some support for their teenage kids, and the vet center is going to be working with them. So that's an important piece to remember. There's more than just the VA. There's the vet center for also therapy that's not tracked by the VA, which I think some vets do worry about.
Yeah, and I'm going to hand it over to Josh in a second, but I just want to give a big shout out to Jim, the Los Angeles Vet Center. That's where I started my therapy, and it's just, they've got really amazing, they're VA employees, but they're kind of like off-grid VA employees, and I mean, it was amazing to walk into a vet center and be able to talk to another female veteran who happened to also been an E5 in the Army when she got out, and have that person walk me through, my own struggles. It was life-changing for me. So yeah, big shout out to the vet centers as well. Josh?
Thank you, Elena. And thank you, Deborah. I think you are a perfect person to give a shout out to the VA crisis line. Could you provide that information for the veterans watching? There we go, and it's up on our screen as well. I think this should be our initial point of contact. It is, at least it is for our office. Veterans call us. We are not mental health professionals, so you need to call this veteran crisis line. The VA has just made it a lot easier, right? 988, then press 1. There's not a long number you need to remember. So, Elena, you just mentioned that you went into the vet center in Los Angeles as a female veteran. One of the comments we just got on Facebook is, and I'm going to ask this to, I think Deborah, Jim, probably this is for you. What about the different needs between men and women vets? I had a completely different experience than my male vet brothers. Of course, right? So let's hear, how do we address those? Do we have the capabilities to do that? We're doing it.
I think we are. And I was at a stand down recently, and I had a female Vietnam vet come up to me, and she said, I immediately just said, oh, where did you serve? And she says, oh, I appreciate you saying that, because when I go to the VA, a lot of times they'll ask me, what's the last four of my husband's social? They never think I'm the vet. And so I think we do a lot of educating. We've been trying to really respond to some of these surveys that we've gotten feedback from the veterans, to be more receptive, to be more available. And like I said, to be more, like when it's a female vet, a female person, don't assume they're there because of the husband. They're there because of the female, that they're a vet. And I apologize. I think I lost my train of thought there for a second.
Okay. No problem.
Yeah. Oh, go ahead, Josh.
No, we just want to welcome Jacob back. A few segments ago, you were talking about the Wounded Warriors Project. I know you want to add more, because we all know Wounded Warrior Project is amazing and helped you a lot. So please tell us as much as you can about Wounded Warrior Project and how they help veterans.
Yeah, thanks, Joshua. Look, it's really simple, man. We can throw all kinds of phone numbers out there. We can say what's available to veterans. We can tell veterans, go down the road and go to this office, go to this place. But the fact is, veterans want to serve. You want to serve? Let's go find the veterans that need the help, and let's go help them. It's so simple, and that's what Wounded Warrior Project does so much, is connect our veterans, connect our brothers and our sisters, and get us in places together so we can build those relationships. We're not going to solve suicide and mental health at the point of the absolute failure. We're going to solve it by getting involved with each other, creating relationships, and not going down that road. And so if you're listening to me, if you're watching this right now, like, let's get involved. You were on a mission when you were in Iraq. You were on a mission in Afghanistan and Vietnam and places all over the world. Let's get back on mission. And it's so simple. I'll tell you guys about something really easy that we do right where I live in Auburn, Alabama. We have coffee on Friday mornings at 7:30. It's this thing called Combat Coffee. It costs nothing. You want to steal it, right? All we do is create a space where we drink coffee. And guess what? Then after we build relationships, we go, hey man, I'm dealing with this thing. Yeah, man, let me tell you about this program that can help you. Let me tell you what happened to me and how you can get involved. And so really, man, outreach is the key, and outreach through creating relationships. And I love that Wounded Warrior Project was there for my family when I was going through trying to figure out myself and trying to get my head on straight, as we call it. They were there for my wife and for my children, and we're still there today. And we got to build those connections, y'all.
Wounded Warrior Project is the national organization, and you're right, Jacob. They do an amazing job of pulling the family members in as well as the veteran. So I'm a Wounded Warrior Project alumni myself. And just to the earlier Facebook question about women veterans, I went on an all-woman veteran camping retreat that was hosted by Wounded Warrior Project out in the deserts of Nevada, and it was such an amazing way to connect kind of outside of the VA walls with my fellow women veterans. But I really don't want to go over the comment from the Facebook person. You know, VA has done so much to improve their services to women veterans, but there is still so much work to be done. And so my advice to you would be continue to show up, be that squeaky wheel, let folks know that you do need a particular type of service, and just be loud about that, because it's not going to change if we stay home, right?
Yeah, I love that. And also understanding that we've got the VA, we've got Wounded Warrior Project, and we've got so many other organizations, even just the VA and the Wounded Warrior Project, we work together. I can think of at least 2 events I'm speaking at in the next couple months that are VA events. We're working together, and this is how we do it. We all come together to get this done.
Jacob, I don't know if it's the Southern accent or what, but you speaking makes me, I'm already helping veterans for 40 hours a week plus, but it's very motivating. I can tell you have the passion for it, and I think it's something we all have. We have Jim as well. Jim works in a huge county, has all this experience, so he can make things change on that type of level. We need folks like all of you to come together. Sam as well. We need people that can do multiple things. We all have a story. Deborah, you're the ones that are seeing veterans face to face. So we hope that all of us working together, we're going to get the veterans to come to you, and then you're going to make their life increasingly better. It's just an amazing thing, all of us coming together. I don't know, I knew I wouldn't be able to put that together too much in my head, but I was just thinking about the unique experiences of you all, and all veterans is what makes us all better, right? We all have those different types of experiences. There's different tools we can use, right? Somebody earlier mentioned plant-based medicines. I'm not sure who that was. Facebook guest asked us, is that marijuana? I am not sure if that's marijuana, but I want to make sure we address these questions. That's what we're here for. Our show is called Veterans Voices. So was that marijuana?
So that was me, Evan Jones here. And I can speak to the plant medicines. So I don't, that's a plant that I have worked with that in the past, and it's not one for me. So there's an organization called Veterans Exploring Treatment Solutions. You can go on their website, just Google Veterans Exploring Treatment Solutions. They have tons of information on there about different plant medicines, and they work specifically with special operations veterans. So there's a Navy SEAL, Marcus Capone, who went to work with a couple different plant medicines, iboga and ibogaine, and very powerful for him. And it was actually his wife, Amber Capone, who once she saw her husband come home and the miraculous changes that happened to him, like by working with the plant medicine, she started the 501c3 Veterans Exploring Treatment Solutions. So there's a lot of those popping up. There's a lot of engagement between them, specifically legislation, Joint Chiefs of Staff, like all, there's a lot happening in that area. But marijuana, like, I don't observe that being particularly helpful. It can help some people, and it does help some people. It also seems to have a tendency, if people are working with it without intention, if they're just using it to mask symptoms and stuff like that, it doesn't seem to work well. Whereas, let's say ayahuasca, which if you want to learn some about that, Aaron Rodgers, they just did that 3-part documentary series where he talks a little bit about that, and there's a lot of people talking about it now. But ayahuasca, which is an Amazonian plant medicine, that's a very helpful one. San Pedro cactus is another very helpful one. Iboga out of Gabon in Africa is another extremely helpful plant medicine. And these things, they're observing that these medicines are going into the brain, like iboga and ibogaine, for example, and they are curing TBI and PTSD. And in one administration, one session of ibogaine, for example, can cure a 30-year opiate addiction. There's Texas.
Thank you, Evan. I'm sorry.
I could talk about it forever, but go ahead. Cut me off. Please.
I hope we got the question answered. We will do our very best to answer all the Facebook questions. I really appreciate all of you writing these questions and all of you that have joined us. This is an important topic. We're going to list all the resources from all of the organizations that joined us today after the show. But for today, thank you very much. That is our discussion. I want to thank you all the guests today. Please remember, you can help a veteran by being in touch. By listening, a single text, phone call, or conversation can make all the difference.
We hope you found our conversation educational. We leave you with some resources if you want to reach out. The Veterans Crisis Line is available 24 hours a day. You can always talk with someone who understands. Just dial 988, then press 1, or go to veteranscrisisline.net. Wounded Warrior Project is dedicated to helping those who serve. Find them at woundedwarriorproject.org. The Veteran Peer Access Network helps connect veterans for mutual support and camaraderie. Reach them at mva.lacounty.gov/veteran-peer-access-network. Home Team for Veterans helps train veterans to have meaningful conversations about mental health. To learn more, go to hometeam.reflexai.com. To rewatch tonight's episode, check back on our homepage later this week or check your cable provider's schedule for rebroadcast times. You can also rewatch this episode and many others on our YouTube channel, Veterans Voices of Contra Costa, so be sure to subscribe. Check on the link or scan the QR code to find us on all of our social media channels. Our next show will air on Wednesday, March 12th at noon. We'll be discussing discharge upgrades. You won't want to miss it. To all our veterans and their families, thank you for serving. To all of you who tuned in tonight, thanks for watching and have a great evening.